All right. Good morning, everybody. This is Erik Daly again. This is our Monday, May 3rd, Miller Johnson COVID team Monday morning roundup, and we appreciate everybody taking the time to start their week with us and some of the topics we have planned to cover this week. I'm joined by my partners, Jason Crow, who works in our litigation group, but has a heavy emphasis on cybersecurity, data breach response type topics, and Tim Gutwald, who works with a lot of healthcare providers and is in the health space, kind of monitoring what's been happening with vaccines and the COVID-19 in the COVID-19 world here. So we've been very grateful and fortunate to have Tim along with us the last year or so, and before that, but especially the last year or so, and he'll give us a bit of a tutorial on the latest twist, the back to normal plan. So why don't we, if we could, continue on and just briefly look at the agenda for today's Monday morning roundup, which, as I mentioned, will start with me, and I will briefly cover the launch today of the Small Business Administration's $28.6 billion Restaurant Revitalization Fund program. I'm not going to go into a tremendous amount of detail or answer too many really nuanced questions, because I know we've got a lot of people online from outside the restaurant industry who are interested in some of these other topics, like the cybersecurity issues that Jason will talk about. Maybe talk a little bit about vaccine passport potential developments, as we're starting to see more people vaccinated and coming out of COVID, knock on wood. And then Tim will cover a variety of topics here toward the end. The new back to normal plan, and which is a Michigan specific development for those who may be joining us from outside of Michigan. And then the last two, I think, will be more broadly relevant, regardless of Michigan or whatever other state you may be in. The healthcare provider, an update on the healthcare provider relief fund and Medicare accelerated and advanced payments, and then the new CDC guidelines for fully vaccinated people. So with that said, I'll get us started. And like I said, I'll try to keep things relatively brief. So I've covered these topics in the last 2 or 3 Monday morning webinars as we've been going, and so I don't want to inundate people with the same information. But today is the opening day. We can go to the next slide. And so today we have yet another one of the Small Business Administration programs. The Restaurant Revitalization Fund is opening up to applications today at noon. Today's Monday, May 3rd, for those who may be watching this on YouTube later. If you haven't already, I've noted this here in the sub-bullet point, and if you're planning to apply and you have not yet registered to use this application portal, you want to go do that right after this webinar ends. Or, if you want to do it side by side, that's great too. I won't be offended. The point is, you just want to make sure you're registered and ready to go so you can start the application right at noon, because that $28.6 billion appropriation will not be enough for all the restaurants and other eligible recipients. We don't know that Congress is going to step in to fill any funding shortfall. So it's a first come, first serve, subject to a couple of caveats for priority funding groups and set asides, but get ready to apply. Even if you have to drop off now and go do that, you should. As I mentioned there, from May 3rd today, for the first 21 days, so through May 24th, only the 3 priority groups will be funded potentially. So only applicants who are majority owned and operated by women, veterans, and certain individuals who qualify for socially and historically disadvantaged groups will be able to get funded initially for that first 21 days. However, everybody can apply starting today, and it's to your benefit, even if you're not in one of those priority funding groups, perhaps especially if you're not in one of those priority funding groups, to get your application in as early as possible and to make sure it's complete when you do so, because if it's incomplete, then it'll be rejected and you'll lose your space in line, if you will. But this is if you've attended some of our prior webinars, this is not different, this slide, than prior versions that I've shared out. So these are the types of entities, businesses, individuals that are eligible to participate in the program. I won't spend a lot of time talking through this. Obviously, restaurants are eligible. You can come back and look at these slides later, or go to sba.gov to see their full detailed listing. But basically, if you have a transient food service situation like a food truck or food stand, you're eligible. If you're a caterer, you're probably eligible. Bars, etc. So take a look at this if you haven't already. One thing to call out, if you have a restaurant operating under its own employer identification number within another facility where you have operations, that one restaurant business or whatever coffee shop may be in your building that has its own EIN may be able to apply for the grant. So just something to keep in mind. This doesn't have to be your whole business, just any part of your business that has its own EIN that does one of these things. Okay, and then this, just very briefly, this is kind of what I was touching on at the end of the prior slide. Eligible recipients can include entities that are located, say, in an airport or within a hotel or a conference center if they're operating independently. Franchisees and franchises, so if you're a Subway franchisee or maybe McDonald's franchisee, they're publicly traded, so they would McDonald's itself would be ineligible because they're publicly traded, but McDonald's franchisees with fewer than 20 or fewer locations may well be eligible, but there are some special rules for that. You need to have your franchise listed in the SBA's franchise directory. I think hopefully at this point most of the major restaurant franchises are so listed, but if you operate sort of a smaller franchise, you may want to double check that with your franchisor. And then just like with all these other SBA programs, you still need to certify that current economic uncertainty makes the funding necessary to support your ongoing or anticipated operations. So that's not a certification you want to make lightly to the government, to just make sure that you have some factual and if you want, subjective basis for believing that, and kind of keep a record of it for your file. All right. This also has not changed compared to the last time that I went through it, but just as a reminder, as we're here on the launch date for the SBA accepting applications, these are some of your ineligible types of recipients. Public companies I already alluded to. Larger operations, so you have 20 or more locations, regardless of whether they operate under the same name. That's an ineligible business, too large for this program. Businesses that received a shuttered venue operator grant or are still applying for one of those grants would be ineligible unless they withdraw the grant application for the shuttered venue grant. State-owned businesses, not-for-profits, also ineligible. If you're involved in a bankruptcy proceeding, under certain circumstances, you may be ineligible. And then, as I mentioned, there are special rules for franchisees, and you just want to make sure that your franchise is correctly listed in the SBA's directory. And if it's not, work with your franchisor to get it listed. There's still time to do that. All right, so that's the background, and that's kind of rehashing some of this information that we've gone over together in these webinars before. The SBA has done a number of webinars of its own over the last week or so to preview the application portal and the process. They have a user guide, a program guide, an application, searchable knowledge base, they call it. It's basically a searchable FAQ that is a little more user-friendly maybe than some of the FAQ documents they've released for other programs. But there's more of a complete picture now, thankfully, since opening application day today. So some tips based on being involved as a viewer, at least being involved in some of those programs. So you want to review the sample application that's on the SBA's website, but do not submit like the actual PDF application. This is an application portal that you'll fill in everything electronically. It's an interactive portal, so as you make choices along the way, for example, the type of business you are may require, so if you're a restaurant versus a brew pub, that's going to change the information that you need to provide to the SBA. So you want to make sure that you do it online through the portal. That'll direct you specifically to the information you need to provide. You don't want to apply through a bank. The banks aren't involved in this program at all. And like PPP, where banks were originating loans that were guaranteed by the government, this is not a loan. It's a direct grant from the government. You're applying either directly through SBA, or there's a couple of point of sale vendors who are operating sort of parallel application portals. Square, which is a popular payment system, and then Toast, which I didn't really know about except for occasionally ordering food online, and it directing me to a website called Toast I didn't really know anything about before this program launched, but I guess they're similar to Square in the restaurant industry. If you use either of those point of sale vendors, you can apply directly through those vendors' systems. But again, you don't want to fill out the paper application if you can avoid it. That's going to take a lot longer and probably result in not getting funded. And then, like all of these programs, you want to know kind of which application type you are and what type of information you need to provide as specifically as possible before you apply, so that you've got it all ready when you sit down to fill out the application. And there are really three main categories of potential applicants. If we want to go to the next slide, that kind of depend on when you started operations. And then there's a fourth category where it's kind of a hybrid. If you have multiple locations that fit into different buckets of these calculations. So calculation one is basically your easiest case. If you were operating in 2018 or earlier, your grant amount is very easy to calculate. It's just going to be the decrease in your gross receipts in 2020 compared to 2019, and then you back out any PPP loans that you might have received. Calculation two is for businesses that open partway through 2019, and they have the option to use that calculation two. I won't read through it. You can look at it. It's also on SBA.gov's restaurant program website. If you open in 2019, you can use that calculation, or you can skip to calculation three and use that one if it's better. Calculation three is for businesses that actually started in 2020 or incurred some opening expenses over the last year or so and anticipate opening soon. And in that case, you're going to calculate your grant amount based on eligible expenses incurred. And that one's a little more time consuming because you can't really pull that information from your point of sale vendor. Like Square doesn't have all the information about those businesses' eligible costs. So you really need to do more work on the front end to get that information together. So if you have questions about that, you can reach out to me or to the SBA. They have a hotline set up. We'll go through in the next couple of slides here. We can move on to the next slide to some other helpful resources for anybody who might be applying today. As I mentioned, these are links to the SBA's program guide, which is available at sba.gov/restaurants if you want to look for it. Otherwise, you can just take a screenshot here, I guess, and go to these sites. We'll also post these webinar slides pretty shortly after our webinar is done. There are some screenshots of the application portal so you can get a sense for what the process will look like. And then the National Restaurant Association has listed, or they've created a step-by-step application guide. It's only 3 pages long, but it hits on the key things, a lot of what we've talked about here, but a little bit more detail around the specific documents and supporting info you need to provide. And then they also, the National Restaurant Association, in addition to the SBA's knowledge-based FAQs, the NRA there has its own set of FAQs based on its discussions with the Small Business Administration, which can provide some helpful insight to applicants who are in maybe unique circumstances and don't fit into one of the easier application categories. Okay, and then as I mentioned, if you still have questions after that, the knowledge base is there at sba.gov/restaurants. Another thing I learned is that the Small Business Administration has its own YouTube channel. I don't think it was super popular before maybe the PPP launched, but they do have some specific Restaurant Revitalization Fund application portal demo videos that you can pull up based on, and it's just really recordings of webinars that they did last week. If you want to see somebody actually use the portal for, I guess, a test case, they did a good job with that last week to give people some insight into what that will be like. And then the SBA in this program, unlike some of the others, has tried to direct people to try to work with their local SBA field offices if they have questions or issues in applying. So here in Michigan, we have our own SBA field office in Michigan. You can Google it, I'm sure, to get the contact info. And then there's local SBDC partners, Small Business Development Corporation, who have done webinars and will continue to do that this week. And there's also a hotline, a national hotline for this application portal, which again, you can find that on sba.gov/restaurants. The hotline is listed there if you need to do that as sort of a last resort. I'm not sure how likely it is you'll get through to somebody who can really answer the tough questions, but that can be another resource for you if you really need it. Or you can reach out to me. I'm going to try to be available, especially beginning at noon today, as we have a number of clients, both conventional clients as well as some pro bono clients through our pro bono efforts who are applying for these grants. So I think that's it. There might be one more slide, perhaps not. I won't go through this in detail now. Just a reminder, this is what the allowable uses of funds are. If you do get a grant, make sure you spend it in one of these areas and keep documentation of that. You have you have at least 2 years to spend the funds. So just keep good records. This is a government grant, not something you take lightly. You could be audited. So you want to make sure you keep a good record of all this. And if anybody has questions that gets a grant about whether something they want to use this for fits into that category, again, you can reach out to me. There's Jason, who's come on video now. If people have questions about the Restaurant Revitalization Fund, you can feel free to type those into the Q&A and we'll circle back at the end. If you don't, that's great too. I think now we're moving into hopefully the part of the webinar that'll be more broadly relevant to our participants. Jason's report on cybersecurity and vaccine passports, and then Tim's update. So I'll just turn it over to Jason now, who, as I mentioned, is a partner in our litigation group. Jason, if you want to provide any more background to our viewers this morning about your practice, that'd be great.
Sure, thanks, Eric. I appreciate the introduction. And I thought your presentation was great, Eric, and very informative, even though I don't own a restaurant. So thank you for that. So my name is Jason Crow. I'm a CIP certified privacy and cybersecurity attorney here at Miller Johnson. I am situated in the litigation and white collar group. So I've done a lot of work in the courts, as well as defending clients in front of various regulatory agencies and the U.S. Department of Justice and whatnot. So what I bring to privacy and cybersecurity is, kind of a real world battle-tested experience. So today I'm going to be talking about, cybersecurity, data privacy, and vaccine passports. which, as Erik alluded to, I think will potentially be a little bit more broadly applicable to folks. But I'm going to just kind of cover the waterfront here. And, if you have any questions or, want to chat further, of course, you can see my contact information on the screen right now. Feel free to give me a call all morning. I'm actually probably going to go from my home office here to the office. So I'll be traveling a little bit, but other than that, I'll be available today. So we could go to the next slide here, get started right away. So like Erik said, I'm going to be talking about vaccine passports. So I guess the first question to answer is, what is a vaccine passport? So here I've got kind of one definition, a paper or digital form certifying a person has been vaccinated against COVID-19 that may be used to grant travel privileges or entry into businesses. And, for me, I used to frequent live music venues prior to COVID. And so, the businesses that I hope to be able to get into with a vaccine passport very quickly would be live music venues. So if we go to the next slide here, I can kind of hopefully provide some context. So when in my prior life, before being a lawyer, I was an international documentary filmmaker. So I did a lot of international travel. And the vaccine passport that I received back then was this little yellow card. And some of you on the webinar today may even remember getting this if you've ever traveled abroad. I spent some time in Ethiopia and Uganda, and I had to have, here we see the yellow fever vaccination record. But I think I had to have like 4 or 5 shots, and I went to the Kent County Health Department. They gave me all of those shots. I got a vaccine passport essentially on paper, and went ahead and traveled, and lots of people read it, and they were, I didn't get entry into those countries if I didn't have these vaccinations. So, vaccine passports in some sense are an old concept, and they're just getting some new play here in the COVID-19 era. So in fact, Jeff, if you could forward ahead 2 slides, that would be great, actually, to the next slide. Yeah. So what do vaccine passports look like today? So if you can imagine, the vaccine passports of today end up on your phone, your iPhone, your Android phone, whatever it is. And here we see the state of New York has a vaccine passport called the Excelsior Pass. And the Excelsior Pass is similar to what I've seen in terms of an international travel digital passport of COVID vaccination passport called the Common Pass. But here we see a QR code. And that QR code would be scanned by a business, or if you're at the airport, they could scan it, and they could find out whether you've been vaccinated or not. And here, I believe you can also include information as to whether you've had a recent negative result on a COVID-19 test to see if you actually have COVID-19. And so, this is the vaccine passport of today. And the idea here is to really speed up and normalize the process of verifying whether you've had a vaccine or, a recent test that proved negative. And, from a cybersecurity attorney's perspective, this is really cool. I think it's going to help to go a long way to help open up businesses in certain venues, because if you can imagine, even though travel is down by, 30%, some significant amount, the lines at the airport are sometimes just as long as they verify things like recent COVID-19 tests and vaccinations. So the idea here is to speed things up, make things easier for everyone, and get people into venues in a safe fashion. So now if we go back a slide, I'll give you a quick overview of kind of where the country is at from, I guess, passing laws facilitating vaccine passports like we just looked at. So here we have a statement from the Biden administration that they will not mandate Americans to obtain a uniform vaccination credential. In Michigan, I know that Miller Johnson is located in Grand Rapids, Kalamazoo, and Detroit. And in Michigan, we have no action on this front so far. There's been a bit of controversy where one side of the aisle is saying we're going to come out against vaccine passports as required by the government. And there's a debate going on in Michigan, but there's no action so far. We just looked at New York's Excelsior app. Florida and Texas are kind of going in a different direction as New York. And in fact, yesterday I called my brother who lives in New York, and we started talking about the Excelsior Pass, and he was actually downloading it with me yesterday and taking a look at it, and it's pretty interesting. So Europe, Europe has proposed this digital green certificate, but I don't know if we have any folks from Europe today, so we'll just maybe move on to the next slide. So I want to kind of quickly, I don't know how many New York folks we have, but what's nice about the Excelsior Pass is it really, I think it just kind of shows what the possibilities are and kind of where this is going. So here, when you enter your information into the Excelsior Pass, into the web-based app, or you can do it online, you provide your first name, last name, date of birth, and zip code. And then what happens is that once you verify your identity, the app goes out to the New York Department of Health database, where all of the vaccinations and whatnot and COVID tests have been stored. And it takes a look, does your name and your birthday and your zip code match a recent, vaccination? And so, what's interesting about this is, you're entering a lot of personally identifiable information, which, it now is regulated under various state laws and various federal laws. So, already you can kind of see the privacy concerns that are arising. If we go to the next slide, we can kind of continue the discussion here. And when you have personally identifiable information, and in fact, the vaccine, the record of a person receiving a vaccine would be considered protected health information under HIPAA. And Tim Gutwald can correct me to the extent that I'm misstating the law here, because he's our HIPAA expert. It would be considered, the vaccine record itself would be considered protected health information. But HIPAA, the law that governs the confidentiality and the security of that medical record, would only apply to covered entities, or entities like hospitals and physician groups and the like. So, folks give me, I get a call, I don't know, about once a month that says, some random person, saw my health record, and, it's a violation of HIPAA. And then we kind of walk through the analysis to say, well, does actually HIPAA apply in this case? Because what you're telling me sounds like, it doesn't involve a hospital or whatnot. So here we've got, various legal regimes that govern the private information that you're entering into the vaccine apps, as well as the health information and sensitive information that you would be accessing and potentially storing on these apps. So, the CCPA, as amended by the CPRA, that's a very recent law. It just came into effect within the last year or so, and the CPRA, was just voted into law last November. It regulates information like this. The new Virginia Consumer Data Protection Act is very similar to the CCPA. it regulates information like this. And then of course there's the GDPR over in Europe. And what we're finding as this sort of patchwork quilt of privacy and data security laws have come into effect, you have a situation where this type of information could be handled in a different way in every state, right? So New York has its own privacy and data security law that may or may not apply to the health information. I know they've got several data protection and privacy statutes, and depending on how they roll out Excelsior, those statutes apply. So as the vaccine passport concept rolls out to other states, including Michigan. Michigan has its own Identity Theft Protection Act, which is a data breach notification act, where if some of those fields that you enter into your vaccine passport app, if some of those fields were provided to an unauthorized third party, there may be data breach notification obligations in those instances. So we've got several businesses on the line, and so I'm not a labor and employment attorney. We've got a lot of those folks at Miller Johnson. Actually, we have the best labor and employment team in my mind, and they're happy. I'd be happy to connect you with those folks if you want to get into some of the specifics here. But here we have a situation where the U.S. Equal Employment Opportunity Commission has come down to say, they've indicated that employers can require their workers to get a COVID-19 vaccine, even under the emergency use authorization, that employers that require the COVID-19 vaccine must consider reasonable accommodations for employees with disabilities. And then finally, employers can require employees to show proof that they've received a COVID-19 vaccination. So here we have a situation where, the EEOC has come down and said, look, COVID-19 presents potentially a direct threat to the health and safety of the public who will be visiting businesses, as well as to other employees working at businesses. And so given that there's a direct threat, employers can require employees to show proof that they've received a COVID-19 vaccination. And here, that's where the vaccine passport app, could be really handy, because, you could, automate the process. It could be, something that is where the employer and the employee have kind of a separation between the two, right? So a lot of times employers can get tripped up by asking the wrong questions related to someone's health. And so in that sense, if you are only able to view this sort of yes or no, on or off, I have a COVID vaccination, or I've had a recent negative test result, it can protect the employer from asking the wrong questions and getting information that would be potentially regulated and cause problems for the employer. It also protects the employee who, potentially wants to limit the amount of information that they're providing their employer, the personal and sensitive medical information. Given that we've got a patchwork quilt of privacy and data security laws around the states, and each state appears to be potentially coming up with its own vaccine passport use. There's, like I said, there's this common pass, which is for international travel. What are the key data privacy principles that employers and individuals and businesses should think about? So you kind of go back to data privacy principles and data privacy law 101 here. So I actually borrowed this set of privacy principles from the common pass. And what I liked about these was just how easy they were to understand and how practical they were. So if there is going to be privacy, if there is going to be vaccine passports, you'll want to, the data that is stored or shared is only with explicit informed consent. So what I always say to clients is that they always call me and they say, can I do this activity that gathers this type of private information, personally identifiable information? Can I even do it under the law? And I say, 98% of the time, the answer is yes, so long as you provide the proper notice and you receive the proper consent. So the best way to lower risk for an employer or a business is to make sure that when you are collecting any type of sensitive or regulated information, that you're getting the person's consent. Data minimization. So you want to put folks on notice as to what type of data you're collecting. You want to get consent about that data, about the data collection itself. And then in the process, you want to minimize, the amount of personal information that's used for the transaction. And, what I like about the passport setup is that, like I said earlier, it's really a minimal amount of information is in some respects being passed back and forth, or really not even, transferred at all, other than, to be scanned and the business can determine whether they have the vaccine or not. So, each app is probably going to be structured a little bit differently, but, here we have the PII and the PHI stored only at the source or on the user's phone. So the idea is that there isn't a lot of third-party intermediaries here, storing the data and creating all kinds of unnecessary databases that could be breached and whatnot. And then, finally, it's only used for that purpose. Then, of course, you need to implement the administrative and technical safeguards to protect it. So I'll go quickly through this because I think Tim has a lot to cover here. These are the takeaways. Get consent before utilizing a vaccine passport. Create a statement of legitimate business purpose for requiring and retaining the vaccine passport data. Make sure that you follow the privacy principles, right? You provide good notice of what you're doing, how you're doing it, you get consent, and then you protect the data after you have it. And then finally, of course, I wouldn't be a lawyer if I didn't say, review your contracts with third parties as to, where your data is stored and make sure that it's protected. So with that, I'll let Tim provide us with some additional insight here. And he's got a few things to cover, so.
All right, thank you, Jason. I think that's a kind of a nice segue to especially this number 4 topic here on the CDC guidelines, where we're starting to see different rules for people who are vaccinated versus people, or I should say recommendations rather than rules, at least from the CDC. As far as mask wearing, as far as quarantining before or after exposure, or before and after travel. So it'll be interesting to continue to monitor how states approach this and how private entities approach sort of this proof of vaccination issue. So if we want to move to the next slide. All right, so on Thursday, it was, big news. Those of us here on the COVID-19 business group or sort of task force here at Miller Johnson, we all hopped on a call to talk about the new Michigan vaccination to normal plan. I believe Erik came up with what I think exposes a missed opportunity here for the government with his suggestion was vax to the future, which I thought was rather clever, and want to make sure we give him full credit for that. So next slide. Again, so the governor held a press conference on Thursday, April 29th, announced a new 4-step pandemic plan called Michigan Vax to Normal. It was kind of pitched as sort of a challenge to Michiganders with respect to increasing the percentage of individuals who are 16 and over who are vaccinated. So I'm going to kind of use, rather than saying 16 and over repeatedly during the course of this presentation, I'm going to refer to eligible Michiganders. And I think everyone at this point is aware that anybody who is 16 and over is eligible. So again, the plan is based on the percentage of eligible Michiganders who have received their first vaccine dose. For those who have been closely tracking the numbers like I have, and like other members of our Miller Johnson COVID-19 team. The Michigan has a helpful dashboard, vaccination dashboard, that you can find if you just, I usually just Google, actually, I mean, I have a bookmark at this point, but based on the press conference that the government used, based on the numbers that the governor used during the press conference, it appears that they're using the coverage numbers. So there's a number of tabs. If you go to the dashboard, there's vaccine delivered, there's delivery trend, there's doses by vaccine, doses by metrics. And the one that you want to look at based on what the governor used in her press conference is the coverage tab. And you want to go to dose, there's a dose drop-down menu, and look at initiation. And that will give you the number of residents who have been vaccinated. If you go to dose metrics, then you get a slightly different number, because that's based on the number of doses that we here in Michigan have administered, and that number is not the same as people who have been vaccinated for a number of different reasons. And just to keep you updated, you know, when the governor announced this new plan on Thursday, we were at, I believe it's 48.8% of people of Michigan, eligible Michiganders, have been vaccinated. We are now, as of this morning, up to exactly 50%. We're at 4,044,710 Michiganders who have been vaccinated. So obviously we need to reach 55% to get to step one. So that's about 453,000 people. About 400,000 people that need to be vaccinated. And that's kind of what you'll see as you kind of look at the different numbers. You'll see that it's about 400,000 people per 5%. So we're going to move up a step at step one, I mean, at every 5%, and then you have to add 2 weeks over to 2 weeks on top of that. Again, I think somewhat obviously the reason for the 2 week addition is so that the people who receive their initial dose in 2 weeks, they are supposed to receive their second dose, and that will then make them fully vaccinated. And so that's when each of the next steps kind of kicks in. So we'll move up a step for every 5% increase until we reach 70%. For those who receive our sort of newsletters or vaccine updates or different updates every Friday that we send out, you'll recognize that it's about the last month or so, we've been vaccinating about 300,000 people every week have received their initial vaccine. There are more vaccinations than that given out, but a number of them are second vaccinations. So you can see that'll be, you know, about a week and a half or so before we get to that 55% at that pace. And we'll go over a little chart to kind of highlight that in a second here. So, and just by way of some basic math, for every 25,000 people fewer, so if we're at 275, if that's the pace, 275,000 a week as opposed to 300,000 a week, then what you'll see is it adds a day to how long it takes to get to that next 5%. So, and this was the graphic, is a very helpful graphic to see here that they included on a press release and that they went over during the press conference. Again, as of Thursday, we were at 48.8% vaccinated. At step one, we get to 55% plus, and you add 14 days. So at that point, once we reach step one, you get to lift the state's requirement for employers to require remote work when feasible. So once we get to 55%, employers can welcome back all of their employees. Again, and then at 5% after that, we get to 60%, and you add 2 weeks to that. And at that point, we'll be able to increase indoor capacity at sports stadium, increase indoor capacity at conference centers, banquet halls, funeral homes to 25%, increase capacity at exercise facilities and gyms to 50%, and also lift the curfew on restaurants and bars. Step three, when we reach 65% plus 14 days, lift all indoor percentage capacity limits. Again, there'll still be social distancing between seats for restaurants and things like that, but it'll lift the capacity limits. Also relax limits on residential social gatherings. we're still supposed to be in that sort of one household or two household. I can't recall which exactly limitations. We're not supposed to have a lot of different households gathered together. And then finally, when and if, unfortunately, if we reach step 4 and 75% plus 14 days, at that point, the gathering and face mask order will be no longer imposed. And barring some new variants, barring some additional outbreaks or issues with hospital capacity, then there will be, we won't have to implement any further restrictions or orders. So I think, there's a couple, it's clear that one of the things the government was hoping to accomplish here was to incentivize people who might be vaccine hesitant or for some other reason might not have received the vaccine yet. This will ideally, from the government's perspective, incentivize them to get the vaccine so that, no one likes these restrictions. No one enjoys having to eat outside or seeing restaurants struggle or other businesses struggles. A lot of people do not like wearing masks, are tired of wearing masks, and would like to no longer have to do so. So again, by tying these things, these restrictions and lifting those restrictions to the percentage of people who are vaccinated within the state, eligible Michiganders vaccinated in the state, it's pretty clear that the government is hopeful that that will incentivize people to get the vaccine. Another advantage from, aside from vaccination percentages to this plan, at least from my perspective, is that it provides a level of certainty to businesses with respect to what restrictions are going to be in place. As people are aware, currently, we can go, and earlier on, we could go up, we could go down. Restrictions could be imposed, they could be loosened, and then reimposed again. And so under this new plan, barring again some new variants or some hospital capacity issues, once we reach step 1, then that work from home order is going to go away. We're not going to then step back down. We'll just move on to step 2 and step 3 and step 4. So I think there's an advantage to a certain amount of certainty with respect to this new plan for businesses and obviously individuals as well. Again, so for those who are subscribed to our publications, they would have seen this chart in Friday's announcements, Friday's newsletter. Again, this is the Michigan Vax to Normal Challenge. What we did here is we went through, and thanks to Kelly Durad, one of our colleagues here at the firm, she corrected some bad math on my part and was able to come up with these following dates for when we would reach each step. So again, I mentioned the trend for really March and April was about 300,000 new vaccinations. For each of those months, we did about 1.2 million in March and a little bit more than that, thanks to a big jump on Friday into Saturday for April. It was about a little over 1.3 million in April. So if we continue that pace, then we would reach step 1 on May 24th. We would reach, so again, at that point, everybody would be permitted to go back to work, whether they have to or not. We would then also reach step 2 on June 3rd, step 3 on June 13th, and then finally step 4 on June 23rd. So you can kind of see here, obviously, as I said, if you go down about 25,000, it moves the pace back a day for at least step 1, and then it's a couple days as we continue to move down. It's more like 2 days every 25,000 for step 2. Again, that makes sense. You're talking about sort of exponential increases here. So if we can at least keep a pace of 250,000, then all restrictions would be limited, would be gone by July 1st. So we would be able to have a normal 4th of July celebration. Again, if the numbers decrease, then we would have a much longer period of time before we eliminate all of those restrictions. Jason had kind of talked about mandating vaccinations. I would encourage people, if possible, that employers will see these and in the hopes of getting back to normal, eliminating these capacity restrictions, getting people back into the office, will reconsider whether or not they want to mandate those vaccines. And again, that is something we've addressed your Miller Johnson employment lawyer to discuss, what that means for your business and the risks and benefits related to that. So that covers our Michigan Vax to Normal. Again, it's a 4-step process. And that brings us to the other big announcement in the health perspective field, was the new CDC mask guidelines. So again, Tuesday, a couple days before the governor's press conference, the CDC issued some new guidance for vaccinated individuals and new guidelines on mask wearing. There is, a fair amount of pushback. I think some of that was driven, and we'll show the chart on the next slide, by the chart that highlighted different risk levels for different activities. It had smiley faces. Green means it's safe. Yellow means you got to be, there's some risk. Red means the activity was high risk. Those smiley faces also were wearing masks. And if you looked at the chart, there's masks all the time. People are always wearing masks under all of these different activities. And I think people were disappointed, especially when it came to being required to wear masks under certain situations when we're outdoors. But I think if you look at some of the other recommendations by the CDC, particularly related to vaccinated individuals, there was clearly some changes and some relaxation with respect to what vaccinated individuals can do. And again, I think where you're seeing here now is vaccinated individuals having the recommendations allow them to do a few more things. I think that ties in really nicely with the topic Jason just covered on, vaccine verification, this idea of vaccine passports. So what can vaccinated individuals do? They can gather indoors with other fully vaccinated people without masks on or without social distancing. Again, they can gather indoors with non-vaccinated people from one other household. And in that situation, they don't need to be wearing masks. You can travel in the US without getting tested or quarantining before or after. That one seemed in particular to be important with me. I don't do a lot of traveling as a part of my healthcare practice. I have a number of friends that do a lot of traveling. And so this allows them to travel. It's also nice for families. I've got 4 young kids. When there's traveling restrictions and you have to quarantine for school or when you get back or before, those are obviously difficult situations. It could be rather inconvenient, especially for where both parents are working. And so again, by being vaccinated, there's some additional, the recommendations don't require you to continue to get tested. So again, here comes the sort of more controversial aspect, I think, of the CDC mask guidelines, is choosing safer activities. Mask guidelines depends on your vaccination status. And again, it identifies risk level of various activities. If we want to go to the next slide, we can I'm not going to go over all of the different scenarios, but we'll see which is safe and which is not. So again, here's the good news, right? So fully vaccinated people, you can dine in outdoor restaurants without wearing masks, attend small outdoor gatherings, attend small, that's with vaccinated individuals and unvaccinated individuals, or obviously fully vaccinated family and friends. For unvaccinated people, if you're, visiting your relatives, they're all vaccinated, then masks are not required in that situation. If you're exercising outside, if you're at a park, and those sort of situations where there's you're not in a crowded space with a lot of individuals, then you do not have to wear a mask, whether you're vaccinated or unvaccinated. The situation where if you're at a crowded outdoor event, like a live performance, parade, or sports events, at that point, everybody is supposed to wear a mask. And I think one thing to point out here is that the reasoning behind that, and it's clear by the CDC website, if you click on what you can do when you've been fully vaccinated. And the reason for that is we don't have a way of identifying who has and who has not been vaccinated in sort of that crowded environment. Again, if there's just a household or two, and then who's vaccinated and who is not, so it's easier to judge whether or not you need to be wearing masks. But when there's a lot of people, a lot of strangers in a small area where transmission is possible, organizers of those events can't at this point verify who is and who is not vaccinated. So the CDC continues to recommend that masks be worn. And here's just, again, more lists, and you'll see here, it's extremely safe, I guess, is worth pointing out too. If you're vaccinated, all of these are low risk or no risk activities. They're all green, even though you're still required to wear a mask. Again, it's these places, a hair salon or a barber, they're not able to verify necessarily who has a mask or who doesn't. So the requirement or the recommendation from the CDC is still that everybody be wearing a mask. Okay, so here's a link to the website. One thing I do want to point out is MDHHS and MIOSHA have not changed their requirements. The MDHHS mask and gathering requirements or order is still in place. And again, from the MDHHS, all persons participating in gatherings must wear masks. MIOSHA requires employers to provide face covering and requires face coverings when employees cannot maintain social distancing and in shared spaces. So there's obviously way more rules in MIOSHA. Again, we've covered that on a number of situations, and we're coming up on an hour, and I want to get you all out of here and started on your Monday. But I just want to point out that you still need to be following the MDHHS and MIOSHA orders. We'll see how and if they respond to the guidelines. Some early word seems to be that MDHHS will adjust their mask recommendations as a result of this new CDC guidance. All right, real quick here. I know we have a lot of non-healthcare providers, so if you all want to drop off, that's fine. For those who are healthcare providers, the Provider Relief Fund reporting requirements, again, June was supposed to be when the Provider Relief Fund reporting requirements were supposed to kick in. We were already supposed to have been able to provide this information and submit it to CMS. Again, the requirements were issued back in January 15th, but HHS has more or less since that time been reviewing feedback and is revisiting the guidance and reporting timelines that is provided. They are encouraging providers who got more than $10,000 to go ahead and register for the portal. That way it'll be one fewer things you have to do when we do have those timelines and when that portal does completely open up for reporting. Again, just to cover very quickly here, these reporting requirements apply for there's 3 different phases for the Provider Relief Fund. For mental health was in the 3rd, there's rural health also received. And stage 1 was kind of more hospital targeted. I'm being very broad here, but it didn't apply to home infection control distributions, rural health clinic testing distributions, and COVID-19 claims. Home they got money for infection control, that is not going to be connected to the reporting requirements. Same for rural health clinic testing. And then one of the things for administering tests or the vaccine, if an individual did not have health insurance, meaning there was nobody for the provider to charge for those services, you are not going to be charging the patient. What you'll do is you'll submit a claim to the federal government to receive reimbursement for those unpaid services. And this is the last one. I don't know how many providers took advantage of this. I had a number of clients who did, but there was a Medicare accelerated and advanced payments. It was actually a program that existed prior to the COVID pandemic, but the CARES Act expanded the Medicare and accelerated and advanced payment. What the program was effectively an interest-free cash advance. It was based on prior Medicare reimbursement amounts. Again, providers were shut down. They were prohibited from performing surgeries, prohibited from seeing patients in many situations. And so the revenue just disappeared. In the hopes of keeping the doors open, the government offered these accelerated and advanced payments to providers. So they continue to receive Medicare accelerated and advanced payments. And then there was, with the anticipation that eventually these amounts would have to be repaid, again, without interest. And the way that would happen would be for these payments to be offset on future payments. So, providers get they submit claims to Medicare. 30 days later, they get a payment. It shows up in their account as payments from Medicare. This is, how all providers, how all insurance companies make those payments. And the idea would be that number would be reduced if you receive these accelerated payments. So last month, CMS announced it would start recovering those accelerated and advanced payments. So the trigger date would be 1 year after the payment was made. So in most situations, that date has probably already come, depending on when you applied for those accelerated payments, in which case, you can start expect to seeing that offset in your Medicare reimbursement. So if you see, this is, there's nothing you can do to appeal or anything like that, but we wanted to make sure clients were aware if suddenly your Medicare reimbursement looks much smaller than you expected or much smaller than the month before, you need to think, oh, we took accelerated and advanced payments. This is an offset set of that. So the announcement from CMS said it would come starts at 25% of your Medicare payments. So, whatever your Medicare payment is for a given month, up to 25% of that could be applied towards the recoupment of these advanced payments. At 17 months, you'll receive a letter from your Medicare administrative contractor saying, this is the amount you owe, you need to pay that. You'll be given an additional 30 days to repay that last amount, whatever that balance is. After that, there will be a 4% interest charge. So as long as you pay within 18 months, you're not going to have to pay any interest. All right, so we're a little past 9 o'clock. I appreciate everyone who stuck around. I think that was my last slide. If we want to move on to the next one. Again, pitching our resource center, and I think Erik's going to jump on here. It looks like we have a few different questions.
Yeah, thank you. Thank you very much. Yeah, we do want to be mindful of people's time. There are a handful of questions in the Q&A box. A couple of them are fairly specific, but why don't we just take 1 or 2 minutes to see if there are general answers or principles that we would provide to people, even if we don't know the particular answers quite yet. One may be relatively straightforward, and Jason or Tim can feel free to jump in here, but it was noted earlier that if you're mandating vaccinations for employees coming back, you could ask them for proof of their vaccination. I think the question is, if you don't have a mandate for returning to work, a vaccine mandate, can you nevertheless still ask employees to provide, or require employees, I guess, to provide proof of the vaccination if in fact they did receive it?
I mean, Erik, I think the answer to that, I believe, is yes, that you can. I think the question is whether or not you should. Again, if you're asking this sort of information, we got some privacy concerns. You've got some, health-related questions which raise other employment issues. And so I think the question is, why are you asking that question? It might be because, I'm looking at the second question here, that you're trying to determine who can sit where without a mask, or who can wear a mask, or who is not required to wear a mask. And so, again, if there's a gathering indoors of 6 people, the recommendation for CDC is that they would not be required to wear a mask. But again, I think we need to be looking at the MIOSHA requirements. So, my answer to the second one would be that, if you're at work, the MIOSHA requirements are still going to require that masks be worn in those situations. So, we talked about the CDC guidelines, but until Michigan, whether it's MDHHS and MIOSHA, change their recommendations and their rules, then we need to continue to operate with the status quo, how we have been for the last, going on a year at this point.
Yeah, Tim, you kind of read my mind in terms of the transition between those two questions. And for those who may not be able to see, I don't know if folks can see this, the next question posed that I was going to take some minute before we wrap up here was, okay, in the office place, if you have 6 people who've been vaccinated, and let's take an example where the employer has been able to confirm because they've required vaccination cards, for example, to be provided, or the vaccination passport. If you have 6 people like that, can those 6 people meet together in a room without masks? And if so, do they have to socially distance? And Tim kind of alluded to some of the considerations there. And that might be one reason why even an employer who doesn't require the vaccination to return to work might still want evidence of those who claim that they've received it, so they can manage, kind of meetings, who sits where, even if everybody's back in the office. So that was the last. There's one or two other questions. Jason, I don't know if you have anything else you want to add to that discussion. I don't think we're going to have time to get to the remaining question. But if there's anything else, Tim or Jason, that you'd like to add before we wrap up, please feel free to.
No, I think you all have covered it nicely.
Like I said, I mean, I think the main takeaway for people asking about masks and vaccination status at work is that until MIOSHA and MDHS change their orders, just continue to do what you've done before this new CDC guidance.
All right. Well, thank you both so much for sharing your time and expertise with us on Monday morning roundup here. And it was a busy one today. We appreciate everyone taking the time out of their schedules to start their week with us. As always, if you have follow-up questions, feel free to reach out to any of us or our colleagues. We'll get you directed to the best resource for the Miller Johnson. And we hope everybody has a great week, great Monday, and stay healthy and stay in touch with us. We'll be back again next Monday with some hopefully new and additionally relevant topics. Take care.
Thanks, Eric. Thanks, Jason. Bye, everyone.
Bye.
Yeah, thanks, guys.